everyone, this is Nurse Anna from nursestudy.net, and now we have 75 brand new endocrine NCLEX questions with answers and rationales. Enjoy. And if you would like one of our free audiobooks with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions.
Question 1. A 45-year-old female presents with exophthalmos, weight loss, heat intolerance, and irritability. Her TSH is suppressed, and free T4 is elevated. What is the nurse's priority intervention during a thyroid storm? A. Apply eye drops to prevent corneal damage. B. Administer acetaminophen for fever. C. Place the patient on a cardiac monitor. D. Encourage ambulation to prevent DVT. Correct answer, C. Rationale: thyroid storm is a life-threatening complication of hyperthyroidism. Cardiac monitoring is essential due to the risk of arrhythmias and hemodynamic instability. Eye care and antipyretics are supportive, but monitoring cardiac function is the immediate priority. Question 2. A 58-year-old patient with Addison's disease is admitted with severe hypotension, abdominal pain, and vomiting after missing 2 doses of hydrocortisone. Which order should the nurse anticipate? A. Administer IV insulin. B. Administer IV hydrocortisone sodium succinate. C. Administer furosemide IV push. D. Prepare for thyroid hormone replacement. Correct answer, B. Rationale: the patient is in an Addisonian crisis, requiring immediate IV glucocorticoid replacement. IV insulin, A, and diuretics, C, are inappropriate and would worsen hypotension. Thyroid hormone, D, is not indicated unless hypothyroidism is present. Question 3. A nurse assesses a patient with newly diagnosed Cushing's syndrome. Which finding should the nurse report immediately? A. Purple striae on the abdomen. B. Blood glucose of 178 mg per deciliter. C. Serum potassium of 2.8 milliequivalent per liter. D. Weight gain of 3 pounds in a week. Correct answer, C. Rationale: hypokalemia is a dangerous complication of Cushing's syndrome due to increased mineralocorticoid activity. It can lead to cardiac arrhythmias and muscle weakness, requiring urgent correction. Question 4. A patient receiving desmopressin for diabetes insipidus reports headache and confusion. Which nursing action is most appropriate? A. Reassure the patient that this is a common side effect. B. Hold the next dose and notify the healthcare provider. C. Encourage increased fluid intake. D. Administer acetaminophen and reassess in 1 hour. Correct answer, B. Rationale: headache and confusion may indicate water intoxication and hyponatremia from desmopressin. Holding the dose and notifying the provider is critical to prevent further complications. Question 5. A patient with type 1 diabetes mellitus is found unconscious with shallow breathing and fruity odor on breath. Blood glucose is 450 mg per deciliter. What is the nurse's first action? A. Administer IV dextrose 50%. B. Obtain a urine ketone sample. C. Start an insulin drip and administer fluids. D. Place the patient in Trendelenburg position. Correct answer, C. Rationale: the patient is likely in diabetic ketoacidosis, DKA. Immediate treatment involves IV insulin and fluid resuscitation to correct acidosis and dehydration. Dextrose is contraindicated initially, and ketone testing can follow stabilization. Question 6. The nurse is caring for a patient who underwent a total thyroidectomy. Which assessment finding requires immediate intervention? A. Complaints of hoarseness. B. A positive Chvostek sign. C. Mild neck edema at the incision site. D. Drainage of 20 ml serosanguinous fluid from the drain. Correct answer, B. Rationale: a positive Chvostek sign indicates hypocalcemia, a potential life-threatening complication post-thyroidectomy due to accidental removal or damage to parathyroid glands. This can progress to tetany or seizures. Question 7. A patient with pheochromocytoma is scheduled for adrenalectomy. What is the nurse's priority preoperative intervention? A. Encourage ambulation. B. Administer beta blockers as ordered. C. Monitor fluid intake and restrict sodium. D. Avoid giving antihypertensives until after surgery. Correct answer, B. Rationale: beta blockers are used preoperatively after alpha blockade to control blood pressure and reduce intraoperative hypertensive crisis. Avoiding antihypertensives is contraindicated. Question 8. A patient with newly diagnosed acromegaly is being discharged. What teaching point is most important? A. Avoid dairy products to control calcium levels. B. Take your growth hormone injections daily. C. Report signs of sleep apnea or vision changes. D. Monitor blood sugar weekly. Correct answer, C. Rationale: acromegaly can cause structural changes leading to sleep apnea and optic nerve compression. These symptoms need prompt reporting. Growth hormone injections are not used in acromegaly, instead, somatostatin analogs may be prescribed. Question 9. The nurse is caring for a patient with SIADH. Which intervention should the nurse include in the care plan? A. Administer hypertonic saline as needed. B. Encourage oral fluids to 3 liters per day. C. Administer desmopressin acetate. D. Provide high-sodium meals. Correct answer, A. Rationale: SIAD involves dilutional hyponatremia due to excess ADH. Hypertonic saline may be required to correct severe hyponatremia. Fluid restriction, not encouragement, is the standard management. Question 10. A nurse is reviewing morning labs for a patient with hypothyroidism. Which lab result requires priority follow-up? A. TSH 6.8. B. Sodium 133. C. Hemoglobin 11.8. D. Calcium 9.2. Correct answer, B. Rationale: hyponatremia, no less than 135, in hypothyroidism can indicate myxedema, a severe complication that requires intervention. The other values, while abnormal, are not immediately life-threatening. Question 11. A patient with hyperparathyroidism is admitted with nausea, muscle weakness, and a serum calcium level of 12.5 mg per deciliter. What is the nurse's priority action? A. Place the patient on seizure precautions. B. Administer IV calcium gluconate. C. Encourage increased oral fluid intake. D. Restrict dietary calcium intake. Correct answer, C. Rationale: hypercalcemia causes dehydration, so increasing oral fluids helps dilute serum calcium and promotes excretion. Calcium gluconate is used for hypocalcemia, not hypercalcemia. Seizure precautions are more relevant in hypocalcemia. Question 12. A patient is recovering from hypophysectomy for a pituitary tumor. Which assessment finding requires immediate intervention? A. Decreased sense of smell. B. Clear drainage from the nose with a glucose level of 120 mg per deciliter. C. Slight headache. D. Mild nausea and fatigue. Correct answer, B. Rationale: clear nasal drainage with high glucose suggests CSF leak, a surgical emergency due to risk of meningitis. This requires immediate provider notification. Question 13. A diabetic patient is on insulin therapy and reports feeling dizzy and shaky after skipping breakfast. What is the nurse's most appropriate response? A. Administer glucagon 1 mg IM immediately. B. Have the patient lie flat and start IV fluids. C. Give the patient 4 ounces of orange juice. D. Notify the provider to adjust insulin dosing. Correct answer, C. Rationale: the patient is exhibiting symptoms of mild hypoglycemia. A quick-acting carbohydrate like orange juice is the first-line intervention for conscious patients. Question 14. A nurse is reviewing medications for a patient with newly diagnosed Graves' disease. Which medication should the nurse expect to administer? A. Levothyroxine. B. Methimazole. C. Desmopressin. D. Hydrocortisone. Correct answer, B. Rationale: methimazole is an antithyroid medication used to manage Graves' disease. Levothyroxine is for hypothyroidism. Desmopressin treats diabetes insipidus, and hydrocortisone is for adrenal insufficiency. Question 15. A nurse is assessing a patient with known diabetes mellitus. Which symptom is most indicative of autonomic neuropathy? A. Tingling in the hands and feet. B. Diminished pedal pulses. C. Recurrent urinary tract infections. D. Orthostatic hypotension. Correct answer, D. Rationale: autonomic neuropathy affects involuntary functions, such as blood pressure regulation, resulting in orthostatic hypotension. The other options are signs of peripheral neuropathy or infection. Question 16. A patient with newly diagnosed type 2 diabetes is prescribed metformin. Which patient teaching point is most important? A. Avoid potassium-rich foods. B. Take this medication with meals. C. Do not take this medication with insulin. D. Expect occasional hypoglycemic episodes. Correct answer, B. Rationale: metformin should be taken with meals to reduce gastrointestinal side effects. It usually does not cause hypoglycemia unless combined with other drugs. Potassium is not a contraindication. Question 17. A nurse is caring for a patient with a pheochromocytoma awaiting surgery. Which statement by the patient indicates a need for further teaching? A. I will avoid activities that increase abdominal pressure. B. I understand that stress can trigger a hypertensive crisis. C. I will lie on my side to reduce blood pressure before surgery. D. I may need medications to control my blood pressure before surgery. Correct answer, C. Rationale: positioning on the side does not reduce blood pressure in pheochromocytoma. Avoiding triggers and taking prescribed alpha and beta blockers is key to preventing hypertensive crisis. Question 18. A nurse is preparing to discharge a patient with primary hypothyroidism. Which patient statement indicates the need for further teaching? A. I will take my thyroid pill every morning on an empty stomach. B. I should not stop taking my medication suddenly. C. If I feel better, I can take my medication every other day. D. I'll have my thyroid levels checked regularly. Correct answer, C. Rationale: levothyroxine should be taken daily and consistently, even if symptoms improve. Irregular dosing can lead to recurrence of symptoms and complications like myxedema. Question 19. A nurse is assessing a patient with chronic SIADH. Which finding requires immediate attention? A. Serum sodium of 120 milliequivalent per liter. B. Weight gain of 1.5 pounds. C. Fatigue and weakness. D. BP of 100 over 60 millimeters of mercury. Correct answer, A. Rationale: a sodium level of 120 milliequivalent per liter indicates severe hyponatremia, increasing the risk of seizures and neurological decline. The other findings are expected or mild. Question 20. A nurse is caring for a patient with suspected diabetic ketoacidosis, DKA. Which lab result supports this diagnosis? A. Blood glucose of 178 mg per deciliter. B. Bicarbonate level of 10 milliequivalent per liter. C. Serum sodium of 138 milliequivalent per liter. D. Potassium level of 4.5 milliequivalent per liter. Correct answer, B. Rationale: a low bicarbonate level indicates metabolic acidosis, consistent with DKA. Hyperglycemia is typically greater than 250 mg per deciliter in DKA, and sodium/potassium levels can vary. Question 21. A patient with newly diagnosed type 1 diabetes mellitus asks why insulin injections are necessary. Which is the best explanation by the nurse? A. Oral medications are too strong for your condition. B. Your body cannot produce insulin and needs a direct replacement. C. Injectable insulin helps digest the sugar in your food. D. Oral insulin is not absorbed well, so we prefer injections. Correct answer, B. Rationale: type 1 diabetes is characterized by absolute insulin deficiency due to autoimmune destruction of beta cells. Insulin injections are necessary to replace the hormone the body no longer produces. Question 22. The nurse is educating a patient with chronic hypothyroidism on levothyroxine therapy. Which statement by the patient indicates a need for further teaching? A. I should take this medication with breakfast each morning. B. I will notify the doctor if I feel unusually tired or cold. C. It's important to take the medication every day at the same time. D. This medication will likely be a lifelong treatment. Correct answer, A. Rationale: levothyroxine should be taken on an empty stomach, ideally 30 to 60 minutes before breakfast to enhance absorption. Taking it with food can reduce its effectiveness. Question 23. A nurse is assessing a patient with long-standing hyperthyroidism. Which finding suggests the complication of thyrotoxic myopathy? A. Fine hand tremors. B. Proximal muscle weakness. C. Restlessness and insomnia. D. Goiter and tachycardia. Correct answer, B. Rationale: thyrotoxic myopathy leads to proximal muscle weakness, especially in the upper arms and thighs, due to the catabolic effects of excess thyroid hormone on muscles. Question 24. A patient with diabetes insipidus is receiving desmopressin. Which laboratory value requires immediate intervention? A. Serum sodium of 150 milliequivalent per liter. B. Blood glucose of 102 mg per deciliter. C. Urine-specific gravity of 1.015. D. Potassium level of 3.8 milliequivalent per liter. Correct answer, A. Rationale: a sodium level of 150 indicates hypernatremia, a sign that the desmopressin dose may be inadequate or the patient is still losing excessive water. This requires prompt reassessment. Question 25. A patient with Cushing's syndrome is admitted for surgery to remove an adrenal tumor. Which preoperative goal is most appropriate? A. Reduce sodium intake to prevent fluid loss. B. Prevent infection by minimizing visitors. C. Increase mobility to reduce cortisol levels. D. Withhold corticosteroids for 48 hours before surgery. Correct answer, B. Rationale: patients with Cushing's are immunosuppressed and at high risk for infection due to excess cortisol. Reducing infection exposure is a priority. Corticosteroids are often continued until tapering is medically directed. Question 26. The nurse is reviewing lab results for a patient with a history of parathyroidectomy. Which value should be reported immediately? A. Magnesium 1.9 milliequivalent per liter. B. Calcium 7.1 mg per deciliter. C. Phosphorus 3.4 mg per deciliter. D. Potassium 4.1 milliequivalent per liter. Correct answer, B. Rationale: hypocalcemia is a common complication after parathyroidectomy and can cause neuromuscular excitability or even tetany. Calcium below 8.5 mg per deciliter requires rapid attention, especially under 7.5 mg per deciliter. Question 27. A nurse is educating a newly diagnosed diabetic patient on the signs of diabetic ketoacidosis, DKA. Which symptom should the patient report immediately? A. Mild hunger before meals. B. Numbness in toes. C. Nausea with deep, rapid breathing. D. Blurred vision after eating sweets. Correct answer, C. Rationale: Kussmaul respirations, deep, rapid breathing, combined with nausea suggest metabolic acidosis, a hallmark of DKA. It requires urgent evaluation and treatment. Question 28. The nurse is caring for a post-op patient who underwent removal of a pituitary adenoma. Which assessment finding requires the most immediate action? A. Urine output of 300 milliliters in 2 hours. B. Complaints of dry mouth. C. Serum sodium level of 148 milliequivalent per liter. D. Sudden onset of severe frontal headache. Correct answer, D. Rationale: a sudden severe headache post-cranial surgery could indicate intracranial bleeding or cerebral spinal fluid leak. This is an emergency that requires immediate provider notification. Question 29. A patient with uncontrolled type 2 diabetes mellitus is admitted with hyperosmolar hyperglycemic state, HHS. Which nursing intervention is the priority? A. Administer subcutaneous insulin every 6 hours. B. Infuse IV fluids and initiate insulin drip. C. Monitor potassium intake closely. D. Place patient on fluid restriction. Correct answer, B. Rationale: HHS requires aggressive fluid resuscitation and insulin therapy to lower glucose levels and correct dehydration. Subcutaneous insulin is too slow for this emergency. Question 30. A nurse is reviewing a patient's medication list. Which medication, if prescribed to a patient with a history of adrenal insufficiency, should be questioned? A. Fludrocortisone. B. Prednisone. C. Ketoconazole. D. Hydrocortisone. Correct answer, C. Rationale: ketoconazole inhibits cortisol synthesis and could worsen adrenal insufficiency. The other medications are used to treat adrenal insufficiency and would not be contraindicated. Question 31. A patient with known hyperthyroidism presents with agitation, high fever, 104.7 degrees Fahrenheit, and tachycardia, heart rate 148 beats per minute. Which prescription should the nurse anticipate administering first? A. Propylthiouracil, PTU. B. IV propranolol. C. IV acetaminophen. D. Levothyroxine. Correct answer, B. Rationale: in thyroid storm, the priority is to control cardiovascular symptoms such as tachycardia with beta blockers like propranolol. Antithyroid medications follow to suppress hormone synthesis. Levothyroxine is contraindicated. Question 32. A nurse is caring for a patient newly diagnosed with primary hyperaldosteronism. Which assessment finding is expected? A. Hyperkalemia and metabolic acidosis. B. Hypertension and hypokalemia. C. Bradycardia and dehydration. D. Hyponatremia and low blood pressure. Correct answer, B. Rationale: excess aldosterone causes sodium retention, leading to hypertension, and potassium loss, hypokalemia. This condition does not usually cause acidosis or dehydration. Question 33. A patient with a history of thyroid cancer is post-thyroidectomy. Which discharge instruction is most important? A. Take calcium supplements if you develop tingling around your mouth. B. Avoid sunlight to prevent skin irritation. C. Monitor blood pressure weekly. D. You no longer need routine thyroid labs. Correct answer, A. Rationale: tingling around the mouth may indicate hypocalcemia from parathyroid involvement. Patients should be educated to report these symptoms and take calcium as ordered. Question 34. A nurse is assessing a patient with suspected acromegaly. Which finding would support this diagnosis? A. Thin extremities and central obesity. B. Delayed growth and puberty. C. Enlarged hands and facial features. D. Buffalo hump and purple striae. Correct answer, C. Rationale: acromegaly results from excess growth hormone, leading to coarsened facial features, enlarged hands/feet, and jaw protrusion. The other findings are seen in other endocrine disorders. Question 35. A nurse is monitoring a patient on long-term corticosteroid therapy. Which lab finding is most concerning? A. WBC count of 14,000. B. Serum glucose of 172 mg per deciliter. C. Potassium level of 2.9 milliequivalent per liter. D. Hemoglobin A1C of 6.7%. Correct answer, C. Rationale: corticosteroids can cause hypokalemia, which is dangerous due to the risk of arrhythmias. While elevated glucose and WBC counts are expected, potassium less than 3.0 milliequivalent per liter is a priority concern. Question 36. The nurse is reviewing teaching for a patient prescribed radioactive iodine, RAI, therapy. Which statement indicates the patient understands precautions? A. I can resume close contact with family the same day. B. I should use separate utensils and wash them separately for a week. C. I don't need to stop my antithyroid medications before the treatment. D. It's safe to breastfeed my infant within 48 hours. Correct answer, B. Rationale: patients receiving RAI must take radiation precautions, including using separate utensils, avoiding close contact, and discontinuing breastfeeding permanently after treatment. Question 37. A nurse is assessing a patient with suspected hypoparathyroidism. Which physical sign is most specific to this condition? A. Tinel sign. B. Chvostek's sign. C. Babinski's reflex. D. Cullen's sign. Correct answer, B. Rationale: Chvostek's sign is a facial twitching response when the facial nerve is tapped, a hallmark of hypocalcemia often seen in hypoparathyroidism. The others are associated with different conditions. Question 38. A patient with type 2 diabetes is taking a sulfonylurea. Which symptom would be most concerning? A. Increased urination. B. Blurred vision. C. Sweating and confusion. D. Mild ankle swelling. Correct answer, C. Rationale: sulfonylureas increase insulin release and can cause hypoglycemia, with symptoms like sweating, confusion, and tremors. These signs warrant immediate intervention. Question 39. The nurse is evaluating a patient with syndrome of inappropriate antidiuretic hormone, SIADH. Which assessment finding indicates treatment is effective? A. Serum sodium decreases to 125 milliequivalent per liter. B. Weight increases by 2 pounds in 24 hours. C. Patient reports increased thirst. D. Urine output increases with stable vital signs. Correct answer, D. Rationale: in SIADH, treatment is effective when urine output increases and sodium stabilizes. Persistent weight gain and hyponatremia suggest continued fluid retention. Question 40. A patient is admitted with diabetic ketoacidosis, DKA. Which of the following would the nurse expect to implement during the initial phase of treatment? A. IV dextrose 5% in water, D5W, and potassium. B. Subcutaneous rapid-acting insulin and oral fluids. C. Continuous IV regular insulin and normal saline. D. Long-acting insulin and sodium bicarbonate. Correct answer, C. Rationale: the initial treatment for DKA includes fluid resuscitation with normal saline and IV regular insulin to reduce glucose and ketone levels. Dextrose is added later when glucose drops to less than 250 mg per deciliter. Question 41. A nurse is caring for a patient with Hashimoto's thyroiditis. Which laboratory value is most consistent with this condition? A. Low TSH and high T3. B. Elevated TSH and low T4. C. High calcium and low parathyroid hormone. D. Low insulin and high C-peptide. Correct answer, B. Rationale: Hashimoto's thyroiditis is an autoimmune cause of hypothyroidism, resulting in elevated TSH due to decreased feedback inhibition and low T4 due to gland destruction. Question 42. A patient with known diabetes mellitus presents with nausea, dry mucous membranes, and a blood glucose level of 600 mg per deciliter. Urine ketones are negative. What is the most likely diagnosis? A. Hypoglycemia. B. Diabetic ketoacidosis, DKA. C. Hyperosmolar hyperglycemic state, HHS. D. Insulin overdose. Correct answer, C. Rationale: HHS is characterized by extreme hyperglycemia, dehydration, negative ketones, and no significant acidosis, unlike DKA, which has ketones and metabolic acidosis. Question 43. The nurse reviews lab results for a patient taking levothyroxine. Which value suggests the dose may be too high? A. TSH 0.1. B. T3 is 80. C. Free T4 is 0.7. D. Sodium 136 milliequivalent per liter. Correct answer, A. Rationale: a low TSH suggests that the thyroid hormone replacement dose is too high, leading to subclinical or overt hyperthyroidism. Question 44. A patient presents with symptoms of fatigue, cold intolerance, and weight gain. Which diagnostic test result best supports a diagnosis of primary hypothyroidism? A. TSH 9.5 and free T4 is 0.4 nanograms per deciliter. B. TSH 2.0 and free T4 is 1.2 nanograms per deciliter. C. TSH 0.3 and free T4 is 0.5 nanograms per deciliter. D. TSH 8.0 and free T4 is 2.1 nanograms per deciliter. Correct answer, A. Rationale: in primary hypothyroidism, TSH is elevated due to the pituitary gland compensating for a low free T4 caused by thyroid dysfunction. Question 45. A nurse is reviewing discharge instructions with a patient who underwent adrenalectomy for Cushing's disease. Which teaching point is most critical? A. You can resume strenuous activity in 2 weeks. B. You may feel flushed as your body adjusts. C. Report any signs of infection immediately. D. Take your medication only when you feel tired. Correct answer, C. Rationale: post-adrenalectomy patients are often on steroid replacement and are immunocompromised. Early recognition of infection is crucial due to suppressed immune response. Question 46. The nurse is caring for a patient with newly diagnosed hypoparathyroidism. Which dietary choice should the nurse recommend? A. High protein, low sodium diet. B. Low calcium, low phosphorus diet. C. High calcium, low phosphorus diet. D. High sodium, high calcium diet. Correct answer, C. Rationale: hypoparathyroidism causes hypocalcemia and hyperphosphatemia, so the patient should consume a high calcium, low phosphorus diet, e.g., avoid dairy, which is high in both. Question 47. A patient with Addison's disease is brought to the ER with hypotension, vomiting, and confusion. What is the nurse's first priority? A. Administer IV normal saline and hydrocortisone. B. Start insulin drip. C. Place the patient in a high Fowler's position. D. Administer oral corticosteroids. Correct answer, A. Rationale: the patient is experiencing an Addisonian crisis, requiring immediate fluid resuscitation and IV steroid replacement, hydrocortisone. Oral meds are inadequate for acute crises. Question 48. Which clinical manifestation best differentiates myxedema coma from other causes of altered mental status? A. Hyperactive reflexes. B. Hypernatremia. C. Bradycardia and hypothermia. D. Hypertension and tachypnea. Correct answer, C. Rationale: myxedema coma, a life-threatening complication of severe hypothyroidism, presents with bradycardia, hypothermia, hypotension, and depressed mental status. Reflexes are diminished, not hyperactive. Question 49. A nurse is caring for a patient with diabetes insipidus. Which of the following indicates that treatment with desmopressin has been effective? A. Increase in urine output to 200 milliliters per hour. B. Decrease in serum sodium to 125 milliequivalent per liter. C. Specific gravity increases to 1.015. D. Decrease in urine osmolality. Correct answer, C. Rationale: in diabetes insipidus, treatment effectiveness is indicated by increased urine concentration, reflected by higher specific gravity, and decreased urine output. Question 50. A nurse is assessing a patient taking methimazole for hyperthyroidism. Which symptom requires immediate attention? A. Mild rash. B. Decreased appetite. C. Sore throat and fever. D. Occasional palpitations. Correct answer, C. Rationale: methimazole can cause agranulocytosis, leading to life-threatening infections. A sore throat and fever are early signs of this complication and must be addressed immediately. Question 51. A nurse is teaching a patient with acromegaly about the purpose of octreotide therapy. Which statement by the patient indicates effective understanding? A. It will help increase my growth hormone production. B. It replaces the hormone my body no longer makes. C. It helps suppress the release of excess growth hormone. D. It controls my blood sugar levels better than insulin. Correct answer, C. Rationale: octreotide is a somatostatin analog that suppresses growth hormone, GH, secretion in acromegaly. It does not replace hormones, nor is it a glucose-lowering agent. Question 52. A nurse is caring for a patient post-parathyroidectomy. Which nursing action is the most critical in the first 24 hours? A. Elevate the head of bed to 90 degrees. B. Monitor for signs of laryngeal stridor. C. Encourage a high-fiber diet. D. Apply warm compresses to the incision site. Correct answer, B. Rationale: airway compromise due to laryngeal nerve damage or hypocalcemia-induced laryngospasm is a life-threatening complication following parathyroidectomy. Monitoring for stridor is critical. Question 53. Which symptom reported by a patient taking long-term corticosteroids should prompt immediate evaluation? A. Increased appetite. B. Moon face. C. Sudden leg pain and swelling. D. Mild mood swings. Correct answer, C. Rationale: sudden leg pain and swelling could indicate deep vein thrombosis, DVT, a possible complication of hypercoagulability due to corticosteroid use and Cushingoid states. Question 54. A patient with diabetes mellitus is experiencing polyuria, polydipsia, and blurred vision. The nurse notes a fasting blood glucose of 310 mg per deciliter. What is the best next step? A. Administer long-acting insulin. B. Provide oral glucose. C. Initiate sliding scale insulin coverage. D. Repeat the blood sugar in 1 hour. Correct answer, C. Rationale: a blood glucose of 310 mg per deciliter with classic symptoms requires rapid correction. Sliding scale insulin is appropriate. Long-acting insulin has delayed onset and oral glucose is contraindicated. Question 55. A patient with suspected pheochromocytoma has blood pressure readings of 210/110 mm of mercury and heart rate of 120 beats per minute. Which diagnostic test would the nurse anticipate? A. Serum cortisol level. B. Urinary metanephrines and catecholamines. C. Dexamethasone suppression test. D. TSH and free T4 levels. Correct answer, B. Rationale: pheochromocytoma is diagnosed using 24-hour urine tests for catecholamines and metanephrines, which are elevated due to tumor secretion of epinephrine and norepinephrine. Question 56. The nurse is caring for a patient receiving IV insulin for diabetic ketoacidosis, DKA. Which lab value requires immediate attention? A. Serum potassium 3.0 milliequivalent per liter. B. Serum bicarbonate 14 milliequivalent per liter. C. Blood glucose 240 mg per deciliter. D. Anion gap of 18. Correct answer, A. Rationale: insulin drives potassium into cells, which can lead to life-threatening hypokalemia. A potassium of 3.0 milliequivalent per liter is critical and requires immediate correction before continuing insulin. Question 57. A patient with a recent diagnosis of Graves' disease is started on radioactive iodine therapy. Which patient teaching point is most accurate? A. Your symptoms will improve within 24 hours. B. You may need thyroid hormone replacement after treatment. C. This treatment will permanently block TSH production. D. You can safely become pregnant 1 month after the treatment. Correct answer, B. Rationale: radioactive iodine ablation often leads to hypothyroidism, necessitating thyroid hormone replacement. Improvement takes weeks, not hours. Pregnancy should be avoided for 6 months. Question 58. A patient with Addison's disease has been prescribed fludrocortisone. What finding indicates the dose may be too high? A. Hypotension. B. Decreased sodium level. C. Weight loss. D. Peripheral edema and hypertension. Correct answer, D. Rationale: fludrocortisone is a mineralocorticoid that increases sodium and water retention. Excess dosing leads to hypertension and edema, requiring dosage adjustment. Question 59. A nurse is monitoring a patient with diabetic neuropathy. Which nursing intervention best addresses this complication? A. Provide high carbohydrate snacks between meals. B. Encourage barefoot walking to desensitize nerves. C. Perform daily foot checks and teach foot care. D. Monitor calcium levels for signs of tetany. Correct answer, C. Rationale: diabetic neuropathy causes loss of sensation, increasing the risk for foot injuries and infections. Daily foot inspections and teaching are essential nursing interventions. Question 60. A patient with SIADH is being treated with fluid restriction and hypertonic saline. Which finding indicates therapy is effective? A. Daily weight increases by 1 kilogram. B. Urine output decreases. C. Serum sodium increases to 134 milliequivalent per liter. D. Blood pressure rises to 160/90 millimeters of mercury. Correct answer, C. Rationale: an increase in serum sodium indicates successful treatment of dilutional hyponatremia in SIADH. Weight gain and fluid retention suggest ineffective therapy. Question 61. A nurse is reviewing labs for a patient receiving desmopressin for central diabetes insipidus. Which finding suggests a complication of therapy? A. Urine-specific gravity of 1.005. B. Serum sodium of 128 milliequivalent per liter. C. Blood pressure 98/62 millimeters of mercury. D. Urine output of 1,200 milliliters in 24 hours. Correct answer, B. Rationale: a serum sodium of 128 milliequivalent per liter indicates hyponatremia, a complication of water retention from desmopressin therapy. This could lead to cerebral edema and seizures if untreated. Question 62. A patient with chronic corticosteroid use is admitted for surgery. Which intervention is a priority to prevent Addisonian crisis? A. Discontinue corticosteroids 12 hours before surgery. B. Administer hydrocortisone IV as prescribed. C. Place the patient on fluid restriction pre-op. D. Monitor glucose every 8 hours post-op. Correct answer, B. Rationale: patients on chronic corticosteroids may have suppressed adrenal function. They need stress-dose steroids like IV hydrocortisone to prevent adrenal crisis during surgery. Question 63. A nurse is assessing a client who is post-op from total thyroidectomy. Which electrolyte imbalance is the nurse most concerned about? A. Hyperkalemia. B. Hypocalcemia. C. Hyponatremia. D. Hypermagnesemia. Correct answer, B. Rationale: Hypocalcemia can occur after thyroidectomy due to inadvertent removal or damage to the parathyroid glands, which regulate calcium. Watch for numbness, tingling, or tetany. Question 64. Which clinical manifestation best differentiates Graves' disease from other causes of hyperthyroidism? A. Heat intolerance. B. Weight loss. C. Exophthalmos. D. Tremors. Correct answer, C. Rationale: exophthalmos, protrusion of the eyeballs, is unique to Graves' disease, an autoimmune form of hyperthyroidism. The other symptoms occur in all forms of hyperthyroidism. Question 65. A nurse is caring for a patient newly diagnosed with hypopituitarism. Which hormone deficiency is most immediately life-threatening? A. Luteinizing hormone. B. Growth hormone. C. Thyroid-stimulating hormone. D. Adrenocorticotropic hormone. Correct answer, D. Rationale: deficiency of ACTH leads to a lack of cortisol, which is critical for stress response and maintaining blood pressure. Cortisol deficiency can be rapidly fatal if untreated. Question 66. A nurse is educating a patient newly diagnosed with type 1 diabetes. Which patient statement indicates a need for further teaching? A. I need to monitor my blood sugar before meals. B. I'll rotate my insulin injection sites regularly. C. I can skip insulin if I'm not eating that day. D. I should carry a source of glucose with me. Correct answer, C. Rationale: basal insulin should not be skipped even when not eating, as it maintains baseline glucose levels. Skipping it increases risk for DKA. This statement requires correction. Question 67. A nurse is caring for a patient with suspected insulinoma. Which assessment finding supports this diagnosis? A. Elevated fasting blood glucose. B. Polydipsia and polyuria. C. Recurrent episodes of confusion relieved by eating. D. Blurred vision after exercise. Correct answer, C. Rationale: insulinoma is a tumor that secretes insulin, causing hypoglycemia. Confusion relieved by eating is classic. These patients typically experience neuroglycopenic symptoms when fasting. Question 68. A patient on long-term glucocorticoid therapy is scheduled for a dual-energy X-ray absorptiometry (DEXA) scan. What is the purpose of this test? A. Evaluate thyroid gland function. B. Assess bone mineral density. C. Screen for adrenal suppression. D. Determine blood glucose regulation. Correct answer, B. Rationale: long-term corticosteroids increase the risk for osteoporosis. The DEXA scan evaluates bone mineral density, important for early detection and prevention of fractures. Question 69. A nurse is caring for a patient with suspected adrenal crisis. Which of the following findings would support this diagnosis? A. Hypertension and bradycardia. B. Hypernatremia and fluid retention. C. Hypotension and hyperkalemia. D. Hypoglycemia and metabolic alkalosis. Correct answer, C. Rationale: adrenal crisis results in hypotension, hyponatremia, hyperkalemia, and hypoglycemia due to lack of aldosterone and cortisol. This is a medical emergency. Question 70. The nurse is teaching a patient with hyperparathyroidism about fluid needs. Which instruction is most appropriate? A. Limit fluid intake to prevent edema. B. Drink 2 to 3 liters of water per day. C. Avoid fluids to reduce calcium excretion. D. Increase milk and dairy products. Correct answer, B. Rationale: hyperparathyroidism leads to hypercalcemia, which increases the risk for kidney stones. Hydration helps dilute calcium in the urine and prevents stone formation. Question 71. A nurse is caring for a patient newly diagnosed with primary hyperparathyroidism. Which complication is the nurse most concerned about? A. Bradycardia. B. Fractures from decreased bone density. C. Hyponatremia. D. Hyperthyroidism. Correct answer, B. Rationale: excess parathyroid hormone, PTH, increases bone resorption, leading to osteoporosis and increased risk of fractures. The disorder is unrelated to thyroid function. Question 72. A patient receiving corticosteroids develops new-onset confusion and muscle weakness. Which lab value is most concerning? A. Serum potassium 2.5 milliequivalent per liter. B. Serum sodium 142 milliequivalent per liter. C. Serum calcium 8.9 mg per deciliter. D. Serum glucose 134 mg per deciliter. Correct answer, A. Rationale: corticosteroids can cause hypokalemia, which can lead to confusion, muscle weakness, and cardiac arrhythmias. A potassium level of 2.5 milliequivalent per liter is critically low. Question 73. A nurse is reviewing discharge instructions with a patient who underwent radioactive iodine therapy for hyperthyroidism. Which statement requires further teaching? A. I'll avoid close contact with others for several days. B. I can share a bathroom as long as I flush twice. C. It's okay to resume breastfeeding in 1 week. D. I need follow-up labs to check my thyroid levels. Correct answer, C. Rationale: radioactive iodine is excreted in breast milk and breastfeeding should be permanently discontinued after therapy due to risk of radiation exposure to the infant. Question 74. A patient with type 2 diabetes is prescribed metformin. Which condition in the patient's history would prompt the nurse to question the order? A. Osteoarthritis. B. Chronic kidney disease. C. Hypertension. D. Gastroesophageal reflux disease. Correct answer, B. Rationale: metformin is contraindicated in patients with impaired renal function due to risk of lactic acidosis. The nurse should verify renal function before administration. Question 75. The nurse is assessing a patient with suspected hypoglycemia. Which finding supports this diagnosis? A. Warm, dry skin and bradycardia. B. Flushed face and bounding pulses. C. Diaphoresis, tremors, and confusion. D. Nausea and polydipsia. Correct answer, C. Rationale: classic signs of hypoglycemia include sweating, shakiness, irritability, and confusion. The sympathetic nervous system is activated in response to low glucose levels.